and good morning to all. We are coming live, and myself, Dr. Ruchi Jain from Nagpur, and I have been conducting a Sadhana Series session since 2020 December. So we have almost going to reach our 100th lecture of Sadhana Series. Since in the beginning for 2 to 3 years, it was every week and then every month. So it's an ongoing process of taking ahead the light, the energy of our Guru, our Sir, Dr. Praful Vijayakar Sir. Okay, so I hope you all are there with me in this journey and you will enjoy also whatever sessions we take, whatever learnings we had from Sir. That is what we are sharing with you people. And this is a process which has been going on, and the things which have evolved during this process have been very tremendous. And definitely, I can see the change, the and observe the change which has been going inside me in this whole process. So, when we give, we get. This is what Sir had already taught us. So, going ahead today, it's a very interesting topic. So, I want you all to be actively participating in the whole session. Please put your questions and doubt into the chat box. And so, here the journey begins where I see myself as a small child of predictive, a student of predictive, and the journey started way back in 2010 when we used to go to Sir. Like when we started with this journey, I was really a very small student, just like a toddler in a family. So, this was the family where we have grown, and now we can say that we are growing through the knowledge of our Bade Sir. I would always say that he is lion of homeopathy who has taught what homeopath has to grow and how a homeopath needs to grow. But what happened is when we have a guru in our life and when he leaves, his soul is there with us to guide us in every nooks and corner. So this was our guru who had started a new hope for homeopaths. He has given that homeopathy is limitless and the scope of homeopathy is also limitless. So he had started a very good venture where he said ki even Hanuman sir has promoted that you all should go with charity. This is there in the aphorism also. So when you talk about charity, he started with this hope for hopeless camps which are running all over the India right now, and they are banging, crossing the limits of giving cure to so many students, so many patients who are coming that they have no hope in other sciences. So this is what homeopathy is. And you would always say that homeopathy is not made for just small diseases, but it is a very divine science. And this divine science is bringing down to you all the blessings from your masters to us. So this is what the vision he had, that every homeopath should treat all the incurable cases. I was an eyewitness to this case, which is visible to you on the screen. This case was there when I was like, I didn't believe that yes, homeopathy can also work so tremendously. When I was a very small student, I was eyewitnessing, yes, the miracles happening. And this child was actually curved and rounded when we went for the camp. I have seen he was actually twisted. There was kyphoscoliosis, and the child was winded like this. And he came from Gujarat. And through my experiences, personally, I saw as the days and in a year time, I could see that he has actually straightened himself, and this was miracle in front of our eyes. How is it possible? Ki a single remedy, a single dose can give so many miracles and so fast results. So this was one hand experience when we went for any of the Hope for Hopeless camps or even attended Sir's lecture. And when we came back, we would always observe there was a transformation into our life, and that transformation was like we became a good homeopath. We used to started attracting so many cases like that, and when we used to ask, sir, how is it possible ki all the cases which you discuss and we get those remedies coming to our desk, or even we are getting those cases coming to us, and we are too small right now to handle all these things. Sir would always say ki, see, we have a WhatsApp with a divine connection to the universe. So when you are into predictive homeopathy, it's one of the biggest blessing, and it is not you who decides to become a predictive homeopath. It is the universal law which decides that you have to become a predictive homeopath. And therefore, when you get connected to this divine energy, automatically the universe starts supporting you. And when you are on this mission of curing the sick to health, the whole universe is in your support. So when we are treating such cases, when we are observing such cases coming to our desk, through Sir's blessings, you won't believe ki even new nates, like all new students who had just joined predictive, could crack such wonderful cases and give wonderful results to homeopathy, which was really remarkable and wonderful. So this is what Sir had always taught us, and this is what Sir had always told us ki if you keep working hard, sky is the limit. He would not give us a meal to eat. He always taught us how to prepare the food for yourself and how to grow in your life. So, this is what the learning of Sir is. And this has been unstoppable even when he is not here in his divine soul, on divine body, but his work is still continuing. So, what else do you want? This is the divine power, what Hahnemann Sir has transferred through him. So, he's just not called as Lion of Homeopathy like that. He has proved himself, and his word is being carried forward by all the students like us, and we are really grateful to him that we can conduct such camps at our own places. It's been 10 years for Nagpur to experience Hope for Hopeless camp, and we have been going through this unstoppable, unbreakable process since last 10 years. Even COVID couldn't stop us. So this is the power of homeopathy, and from the first hand experience of my cases, through which the learning of Sir will be reflected here. So stay with us and stay tuned. I will definitely try to satisfy and give you the knowledge, the ray of hope what he gave to me. So when you talk about what we are going to deal with today, so as we have already said, it is about the scope of homeopathy, not only in genetic cases, a mutational disorder, but definitely in those cases where there is no cure. And therefore, Sir has named it. It's a hope for all those cases who are really treated as hopeless. And it is not only a single child coming to you as a patient, but it's the whole family who is suffering because of the mutational disorders, the children who are suffering. So even the parents go through that pain, the whole family suffers. And when you give cure to them, you won't believe, friends, when I started treating, and I'm very much amazed when these children come to me and parents tell me, Ki ma'am, we again have started our own life. After 10 years, after 5 years, since the child is born, till that time, we could not cross the boundaries of our home. We never saw what is going around in the families. But after starting the treatment with you, the child has become quite stable, independent to some extent, that we can live our life back again. So, this is the sharing of the experience of genetic mutational cases and how we can give hope to these cases and give wonderful results through homeopathy. So, this is our mission, that we are here not to just become a common homeopath, but to become a homeopath giving high hopes, giving high energy to these students, these patients, and even also to the upcoming homeopathic doctors, that this is what the mission of homeopathy is. So, when we are really on this mission, we don't treat only common cases, we treat all those incurable cases which are being considered hopeless for other sciences, but they we can give a good hope to them, and this is what the best quality of a homeopath can be. Highest ideal of cure is rapid, gentle, and permanent. So when we are on this mission, we are not brutal physicians, we are not using any painful processes, but our sweet little pills are able to give wonderful cure to those patients who are not able to get any cure from other sciences, and we are not actually treating through any painful modes. The medicines we give, the way we treat the patients, we are best friends to them, we are patient listeners to them. These people have not shared the pain in the heart, being dug so much within their souls, that when they give the case to us, they feel the connection, the soul connection comes up, and then the divine plan is really restored. And again, something which was impossible becomes possible through our medicines. But it is only possible when you follow the comprehensible principles, that is, the cardinal principles, which is laid down through our masters. And definitely our Bade sir has laid down few parameters. If you walk on that road, you will never skip any zones. There are no ways out to just release yourself. You just get connected, and it becomes a mathematical science. You treat the patients as if never done before. So it is so mathematical, it is easy, and a single remedy will work wonderfully only when the correct formula is applied, when the correct remedy is selected, and when it is shortest. What is the shortest way? Is because when it is said it is mathematics, it is what 1 plus 1 has to be 2. So if you understand the disease pathology, the journey of the disease, you understand the physical body, you just need to connect it to the mind, to the soul of the person, and you get the remedy out. And definitely this medicine is going to change at the genetic level and bring upon beautiful cures to these cases which are told as incurable cases. And definitely, we know that we are harmless. Why we say we are harmless? Because we are not using any chemical agents, we are not using any brutal therapies where we are giving harm to these patients. Therefore, we are harmless. We become the best person in their life only when your heart is so pure, when your energy is so high, and you are on that right mission with that pure heart. Yes, selflessly, without any intentions, we need to just grow and go ahead on this divine path. Only then that divine energy, because aphorism number 26 says ki we are working on nature's law of cure, and nature's law of cure always say ki you are on that nature's pathway of curing the sick to health. So therefore the nature also supports you, and you start finding such cases, you start manifesting such results and attracting those patients to your clinic, and your clinic also grows. Bade sir would always say, it is my dream that our homeopathy should be to that level that people should select it as the first choice. It will only be possible when we give such miraculous results and such miraculous cure to the patients. So when you're treating all these cases, the best tool, what sir said, is to understand embryology, to understand when you're talking about genetic mutation, when you're talking about genetic mutational cases, the most important thing is understanding the mother's womb, understanding the whole process, how a child is born from a single cell to the multicellular organism, what genes have been transferred to the child from the mother. So embryology, study of embryology is the first thing he demanded that a homeopath should learn and must learn in the process, in the journey of becoming a homeopath treating the mutational cases, because embryology will definitely help you to understand the seat of the disease, the journey of the disease, how an embryo is developing, why the structural changes have happened and how the need versus demand have been fulfilled in the whole journey. What was needed? What was the mother's demand? I want to give child who is very beautiful, who is very intelligent, who is very strong, who is very powerful. So that will get transferred from the mother to the child, and everything will be set goal. And this is what we need to understand when we are taking a case of any mutational disorders or any genetic abnormalities or any cases who are born with congenital anomalies. So embryology becomes the first demand of learning what is homeopathy can do in predictive homeopathy spatially. So embryology is based upon nature's law of development. So you need to understand how a single cell embryo goes ahead and goes to that level कि it a single cell becomes multicellular and single tissue goes and developing the whole organism. What need? Example, if I have a need to see the world, I will need to develop something, a machine which can have a capacity to see the world, perceive the color through the light, can see dark, light, see colors. So, therefore, we have got eyes to see. If my demand was, I want to hear the music outside the world, I want to listen the nature's birds chirping around me, I want to feel the sound waves around me, I need to have ears into me. So this whole journey is based upon the need versus demand versus supply, and this chain has to be understood for each and every cell. Not a single cell in your body is without any cause. Not a single cell in your body is without any purpose. So therefore, even a pathology, if comes, will never be without a purpose or without a cause. So everything has got its own purpose. Every existence has got its own purpose. Even if an algae or fungi is there on this universe, it has got certain role to play to maintain the ecology, to maintain the ecological balance of the nature. And hence, when you talk about homeostasis into your body, each and every cell also has got certain roles to play. And when that function, that physiology is disturbed, the whole system goes disturbed, and the system, if gets disturbed, the pathology grows, the pathology develops. So it's our role to understand at what stage, at what time period this disturbance has happened in the process of growth, and why the growth has stopped over here. What has stopped this growth axis at this level, and what has hampered from a normal child to go to become an abnormal child. So the whole process will be only understood when you know the tool of embryology. So as we all know, this process has started with a single cell, ovum, and a sperm when they reunite to form a zygote, and then this whole process is like millions of sperms, they fight, they are into competition, and only a single sperm, it survives, penetrates into the ovum and gets successful to become a zygote or form a fertilization process. So we are so valuable. We are here existing into this world under that competition of millions of sperm. So we should know the value of life. We should know the value of survival. We should know the value of survival of the fittest. So we are blessed that we are here today because we have already crossed that millions of competition and then we are surviving. So we have to value the life. And what happens when you miss this value of life? When the love of yourself, the love of your life really is getting lost, then the disease processes start. So when you talk about any genetic disorders, you talk about any mutational disorders, as we all know, ki some material is coming from the mother's egg and some material is coming from the father's sperm. So when 50-50% is being divided. But when you talk about genetic disorders, when you talk about mutational disorders, it is very important to understand ki those maximum diseases when are coming to you are all linked to the mother. That is X-linked chromosomal disorders you will find very high. Few diseases are with the Y-linked, and one more important thing is ki they both share some genetic mutations which are being transformed to the child, and this transformation to the child of that genetic information is counted as the whole genetic material which is given to the child. So parental genetic history is again valuable when you are taking any mutational disorder. So one student asked me ki, ma'am, then why you have to take always a mother's history and not go to take a father's history? I will tell you ki because mother, one more important thing is ki mother is transferring the whole genetic material and even father. But maximum diseases which are X-linked do survive and they are carried forward. Maximum diseases which are coming from the sperm side, and if there is a genetic disorder where the sperm is defected or there is some disease which is coming from the sperm end, usually the zygote doesn't cross the age limit and it is really getting spoiled. They don't survive. When it is a Y-linked disorder, yes, go and ask the father's history also, because the paternal baggage will be very important. Then the second thing, since it is of the genetic material, then the second most important thing is, since the mother nature has given the power to only a female to groom a ovum and a fertilized ovum to grow into the multicellular organism or to give a birth to the child. So this is all happening only and only in the mother's womb. So the whole environment, the soil, the seed is coming from the parents, that is father and mother. The seed is germinating in the mother's womb, but the real soil, the sunlight, the water, the energy, the food which is required for this whole ovum to grow is given by the mother. And hence, a mother's history becomes very important when you're treating these genetic mutational cases. All the 9 months, it is the mother which is really connected to the child. And as we all know, today's science has identified it is not the process of only birth which disconnects the child from the mother, but even after the birth of the child, it is possible even till the end of the death of the baby, the whole life cycle, the bond between the mother and child stays, and that is being identified because when the placental circulation is there, some of the cells from the child gets transferred to the mother and from the mother getting transferred to the child, and they stay into the child the whole life, and therefore the bond of the mother and the child is unbreakable. You need to realize that mother's bond cannot be broken, and therefore when we are taking mutational cases, we have to give importance to the mother's history. So whenever a mutational disorder, congenital anomalies, even those diseases which are very much there beyond birth but into the early ages of the child, all those congenital disorders need mother's history for sure. Even not the mother, but generational mother history is also very important. The generations, the history which is being carried forward from one generation. When I see cases, I have cases where the father is there, the mother is there, the child is there. Even father's father had those congenital anomalies which is being transferred from one generation, two generation, three generation. So how is it possible that this mother is only carrying that karma? No, this is something which is being forwarded from one generation, two generation, three generation. So this becomes very strongly into a Mahakaran, what we say, a super causal reason for giving a congenital defect or a congenital anomaly. In that cases, in front, don't take only mother's history, go for generational history, what we say, that first generation, second generation, third generation. And I will tell you, this is not only in these cases of genetic disorders, but even I have noticed that when in cases like infertility, strong cases of infertility, these generational history have really helped to crack the cases when the cause is not being hunted, because without a cause, there cannot be an effect. So if you're seeing any mutational disorder or any congenital disorder or any cases where the identity of the person is hampered, what is identity? That like I am a female, I have to be born like a female and I have to live the world like a female. But if I'm not able to play the role of a female, then that is the identity crisis. And whenever there is a disorder directly hitting the identity of the person, go to the generational case taking, and that will definitely bring cure to all the cases which are there in your desk. I think this is very clear why we take mother's history and when we take father's history. One more thing, very important, is कि when the zygote is developing and before the fertilization takes place, what is very important is that the ovum, the sperm, everything carries a meaning, everything carries a value. Oogenesis and spermatogenesis both carry value. So, sir would always say, ki, in cases, just don't take the 9 months of pregnancy, but also take 3 months before the pregnancy when the couple had started conceiving, started the process, the thought of conception also, because it is being observed ki even today when you talk about garb sanskar, you talk about going to fertilization, even gynae say ki take folic acid once you plan for pregnancy, start it before 3 months. It will give you good quality of ovum, and that is very important. It is also said ki in garb sanskar ki if you're planning for a soul to come to your body, you have to start praying 3 months prior to when you're planning. So, what is this? So, therefore, the quality of ovum, the thought process the mother is carrying, that I am prepared to become a mother. I am prepared now to conceive in the future. So, all these also carry a meaning, and this is very important when you are connected to the cases, because this right seed which is coming from the mother's side, the right soil which mother is going to give, is all the preparation we need. As we all know, ki even a farmer prepares the land before the seeds are sown. Before sowing the seed, the land is being cultivated in a proper way. The manure is given. The nutrition of the soil is being checked. The soil has to be checked before a seed is sown. If you sow a seed on a rock, it will not grow. But if you want the crop yield to be very good, the soil has to be proper, because the soil should have all the nutritional value which is required for that seed to grow. Similarly, a mother who is ready to become a mother, a female who is ready to conceive, a female who wants to conceive and has to follow the nature's law of having that femininity into her, of having that value of motherhood, and having that quality of love and care towards the child. So, this all is the soric need which is required before the mother plans even for conception. Are you getting it? Ki this is so important to understand, because the whole environment is in the hand of mother. The soil is the most important thing. We give so much importance to mother soil, right? So this is why, because why the soil is also called as dharti maa bolte hain, right? We don't say dharti pita, right? We say dharti maa. Why it is called as Dharti Ma? Because this is also a mother who is going to give birth to the nature. The whole ecology balance is based upon this mother nature. Similarly, a female, a human being who is going to give result to this wonderful plan of the universe has to have all the maternal values imbibed in her so that she can execute her role of becoming a mother, and that is what the ultimate demand of the mother nature is given to a female to become a motherhood, to enjoy that motherhood. But what is the creep in the Sora today is that girls are not accepting the motherhood. So you will find in many cases that this motherhood is under attack, and therefore so many PCOD cases are upcoming. You can see these PCOD conflicts coming up and so many diseases of motherhood coming up in all these cases of where infertility is coming up, where you see even the conception becomes so difficult, and then the females are not ready, not prepared to get married at a right age, at the optimum time, and they just are having the feeling that we are yet not prepared. So if the soil says I am not yet prepared, then how can a seed grow and develop and become a tree into it? So it becomes very important that when you are understanding this whole process of embryology, you need to understand ki what was the need of the motherhood and what was the demand which were giving to satisfy this motherhood. So we all started the journey from the sperm when it starts uniting to the ovum. So everything carries a value, right? The thought of getting married, getting into relationship, getting secured into relationship, getting a right partner into your life, everything will carry a meaning. What bond as a male and female they carry, it is not only a relationship but the soul connect between the partners. So the value of a relationship needs to be understood in today's world, and this will be imbibed, and you will see all these conflicts. You will see that the mother is not secured in that home. Mother doesn't feel very much friendly in that environment, and she find herself going into that insecurity and feeling that in this society I am being not protected and everyone is an enemy. And this also is a conflict which gives rise to infertility, because they are not prepared to go to the outer world. They don't feel secured in their own home, they don't feel secured in the environment, and they are resistant enough and they don't want to conceive in the future. So this is all you will see when you search about the environment of the mother or the environment in which the child was born. So everything, every single moment of that mother carries a meaning, carries a value. Even the sperm has to be that strong enough with all the masculine characters so that it can reach an ovum. So everything is valuable. Every event of the life becomes valuable because that cost upon the femininity, that cost upon the motherhood. So let's go ahead. So when we know this wonderful plan is happening, now when the soil is well prepared, the mother is ready to conceive, then the miracle again happens in the womb of the mother, and that single ovum, that single cell sperm, they all unite to form a zygote, then go to the process of being from single cellular to a multicellular organism, and the whole child is born. But as you all know, I'm not here to talk about embryology in detail, but definitely everything has got its stage of fetal development, and every stage carries a meaning, every stage carries a value. So when you talk about this whole pregnancy, it is divided into three trimesters: the first, the second, and the third trimester. So when you talk about motherhood, you talk about the womb, you talk about everything. So this is a luxury compartment where the child feels secured, the child feels protected, the child feels that I am into good hands and I'm growing. So that bond develops between the mother and child. So that bond is also valuable because mother is transferring all her emotions which she's feeling, she's perceiving. This child in the luxury compartment is completely dependent upon the mother and there is nothing from the external environment. But the child also carries its own genetic material, his own constitution, his own soul plan, and therefore even the child will also show his own own dispositions which can be perceived in through the mother also. So it's a two-way bond. I will give you an example over here. I had a mother which she used to say ki ma'am, I was really very good. I was very kind hearted, but I don't know what happened when I conceived this child. And as the child got into my womb, I became very angry, very aggressive. I was not able to enjoy anything in my life, and everything was becoming very difficult to me to survive. I had started quarreling, and my even husband wondered, my family wondered ki how weird I am behaving. And everything had gone when I delivered. And when we saw the child was really very cranky, angry, quarrelsome, and destructive. So even the disposition of the child can be seen in the mother's womb. I had a recent one of my friend who delivered and she said, "Ma'am, my child doesn't sleep from 2 to 5 a.m. And for my wonder, even pregnancy में ना मैम मुझे 2 से 5 बजे तक की नींद नहीं आती थी. And similarly, the child is also not sleeping from 2 to 5. But before it was not like that. Since I am pregnant, तो मेरी साइकिल डिस्टर्ब थी और अब मैं यही चीज अब प्रेगनेंसी होगी तो आई एम एबल टू स्लीप बट मेरा बच्चा आज भी वो 2 से 5 में ही जागता है. So that constitution also has its own disposition which is coming up because this is individualization which we need to understand in the course of disease understanding. Why this is important? Because when you're treating genetic mutational cases, you have to take conflict from the mother and conflict and the disposition of the child. So both carries value which will be taken ahead. So when the child is coming to the environment, the child is born, this whole mechanism is also very wonderful. The normal delivery of the child and coming to the environment also carries a value. So when you are taking genetic mutational cases, not only the whole pregnancy history, but also the delivery part becomes very important. As in CP, MR cases, you will find the child was absolutely structurally normal, healthy and hearty. But during the process of delivery, because of impacted labor, delayed labor, there was an hypoxic injury, there was ischemic injury to the brain, and because of which there is cerebral or cerebellum or any part of the brain which has got affected because of hypoxic injury, and therefore the child is not living a normal life. So you have to consider each and every milestone of the pregnancy. So the process of history starts 3 months before the pregnancy and ends till the process of delivery, and even after delivery, the 1.5 month when the child is completely till the child is dependent on the mother's breast milk also. So in which cases what will be considered, what is given to be the importance, then comes the problem is that if you will ask me ki, do we have to take in each case everything? No, everything has to be filtered. If you give a garbage in, you will get a garbage out. You need to understand the pathology. You need to understand the stage of disease. You need to understand the whole process, right? So, when you see a child who is born with some structural abnormality, like abnormality of face, there is dysmorphism. When you see structurally the child is stunted growth, the hand is not grown properly, the legs are not grown properly, the missing of some organ like undescended testis is there, the kidneys are horseshoe shaped kidneys, or any structural abnormality of the heart, any structural anatomical defects which can be visible to you, right? Even mutational disorders, because any mutational disorder will also give a structural abnormality. So when it comes to a structural deformity, you have to consider 3 months prior history in mutational cases. because genetic mutation is when the ovum is getting transformed and the whole genetic material is being properly stacked up in the chromosomes at that time. This is all important when you understand the genetic disorders or the mutational cases. And one more important thing is when you understand any structural abnormalities, please take the first trimester of the whole pregnancy, because when you divide this whole pregnancy into first trimester, second trimester, and third trimester, the first 3 months is where the whole plan is being decided. The centers are being placed in the body, and you know that you want an eye. So, if you want an eye, the whole planning and programming is done over here, right? So first 3 months is where the body decides where the tissue has to be placed, what tissue is required, what quality of tissue has to be developed, and what structure has to be placed where. So the blueprint, what we say, the blueprint is through the chromosomes, but the structural planning and programming is in the first 3 months. So if you have a perfect balanced 3 months, then everything is superb. You have a structurally normal looking child. Okay? A balanced looking normal human being. But when there is defect in the blueprint of the mother, like chromosomal abnormalities or mutations which come up, then the second month is also not valuable. It is the first month, and even prior to that first month, the fertilization becomes very important. Then you talk about structure, then you talk about physiology. When you see physiology, the next 3 months, that is the fourth month, fifth month, and sixth month, where the physiology is developing. So whatever structures are being made, the connections are formed, the nerves start developing. So diseases like autism, diseases like even diseases where neurodevelopmental abnormalities are there, all those diseases where the physiology and the functions, like ears are there but ears cannot listen, deafness, mutism, and autism, all these cases will go under the second trimester. That is where the physiology or the function is being achieved. So there, take the history of third, after third month, that is fourth, fifth, and sixth month, that has to be taken into consideration, because that is physiology, connections between the nerves. The organs are now structuralized. Now they are getting connected according to the functions they have, right? Now, when you talk about the third trimester, which is the higher functions which are going to develop, you have a computer. So hard disk is made. You get a software getting installed. So that software is nothing but your trimester. So spatial functions which need to develop, and those spatial functions are very important for your survival. So your intellect, your memories, they all come. So learning disorders, learning disabilities, they will come in the third trimester. So if time permits, in future, if we take all the diseases according to this, so I've started the series where we will take all the genetic disorders and all. So this is where we are dealing with the anatomical part when we are talking about mutational disorders. So when you talk about spatial functions, disorders of 8th, 9th month, where the memory, the intellectual capabilities are developing. So people with poor intellect, you will find that in the mother's history, the mother was not secured in the 9th month. And when you see that structure was important, everything was good, everything was well established, only during the part of delivery, something has happened. So you get all the cerebral palsy cases, some diseases which are affecting because there is hypoxic injury to the brain. So all these motor disorders will develop, है ना? And because of the repercussion which has happened, because of hypoxic injury, the child is unable to live a normal life. So the emotional state of the mother during pregnancy is the subconscious blueprint of the child minds. This is very important statement which need to be understood when we are talking about a mutational disorder. So we are landing up gradually to understand the Down's disease or any mutational disorder. So when you talk about the emotional state of mother, so as I've already told, because we are dealing with some mutational disorders or congenital diseases or any genetic mutational diseases, these state of mother becomes very important, which is going during the pregnancy, because whatever the mother is feeling is directly transformed to the child through the neurotransmitters which the mother is transforming through the placenta. The mother's blood is continuously circulating into the child's womb, into the child inside the womb, and therefore each and every emotion, as which I have already told, is connected from the mother to the child. So everything is dependent on the mother's thought process. So it is not only a conscious process, but also a subconscious process to the soul part. I will tell you one more thing is कि when you talk about that homeopathy is a trinity of mind, body, and soul, right? So mind you can see through emotions, body you can see through the physical structure. What about the soul connect? So whatever the karmic level the burden has, the family is being transformed. The family has everything is being transformed to the child. Everything gets transformed to the child, and that karmic burden, that spiritual connection is also there between the mother and the child. Is said ki the child comes in this world, as is said in spirituality. The child who is coming to the mother's womb either is a friend to the mother to repay the loans which are there in the past life, or it comes as a enemy to the mother to take the revenge of whatever mother had done karmic blockages in the past. So everything has its meaning, everything has got its connections from the past. So all these karmic connection is nothing but the spiritual connection of homeopathy. So if you go to deeper level, you will understand here this mother had 4 children. Then why only the third child has to suffer? Why the mother has to suffer in this whole life that she has 6 abortions, 7 abortions? Why this mother had to have this painful pregnancy? What is the reason behind it? No science can give you an explanation. No experiment can prove you ki why mother is having so many. This is all comes to destiny. It all comes to fate. And therefore you will see ki rubrics like misfortunate feeling, unfortunate, inconsolable, fortune, misfortune, all these rubrics also come into play, because this is delusion doomed, delusion persecuted, delusion that I have to death. Everything will come into play, because this is the karmic bond the child and mother is born with. Why a mother has to give birth to a child with DMD, where the death is assured before the birth is assured? Why a mother has to give questions to your mind, that why a mother has to, when it is a beautiful plan, when it is a universal plan, a nature's plan, then why a universe wants to bring a birth to such a child having congenital disorder? You will not find any reason unless and until you spiritually connect to it, that this is what the Mahakaran is, or the higher soul plan is. So if you have to understand that soul plan, you have to take the history to that level. So when you talk about any mutation, your emotions at superficial level, like simple fears, will never affect. It has to go to that subconscious level to bring upon this congenital anomaly, or to bring upon this destruction. So when you talk about emotions of the mother, it has to be that syphilitic to bring upon the syphilitic change. Sir would always say every cause and effect has to be equivalent. So when the effect is like a child is born with so many anomalies, so dependent child, where the mother, not only the mother, but the family is suffering. So that cause cannot be superficial. It has to be very deep and a very penetrating cause, which is affecting the whole cellular mechanism, which is affecting the whole environment, not only in the mother, but also in the family. So this emotional state of the mother is definitely the blueprint, because whatever the mother is perceiving from the environment is directly getting transformed through the genetic material, because this cell which is getting this is called as proteinomics. What sir would say is ki whatever the environmental perception this mother has, this environmental perception she's creating into her, the RNA will transcript and then it will get translated, and similarly the DNA will be formed according to the perception the mother is transferring to the child. And that whole genetic code has to be understood when we are talking about any treatment based upon these genetic disorders. So the whole environment of the mother, the perception of the mother becomes so important, so valuable when you're treating all these genetic cases. So when we come to the topic of Down syndrome, as we all know, these cute little children are suffering because they have got a genetic disorder, and which is caused because there is a third copy of chromosome at the number 21. So what does it mean? As a homeopath, how will you understand the disease? How will you understand these mutational disorders? And how will you associate it for a particular analysis and come to a remedial cure? So when you talk about this, we all know that they have, you must have seen the movie Sitare Zameen Par, where the Downs children have worked beautifully. They have acted so well that these children are actually, they can have certain good abilities. I had a child of Down syndrome. If you just tell him a date and he will tell you the day even in 20 years back, so they can be clairvoyant, they have got good abilities, so they have certain abilities. So they are spatially disabled children. They are not always like mental retarded children. Yes, they might have delayed development, but they have got a capacity to learn certain things in the course of time. So they have children with specific physical characters. So you can find Downs, you can identify Downs around you just through seeing to them that yes, this is a Downs child, because they have a typical genetic feature which is resembled on the face. So when you talk about this child of Downs, you see that structurally they are not normal. So therefore, the cause will not be in the second trimester or the third trimester. It is in the first trimester of the pregnancy. And since it is a mutational disorder, again, the formula will be in the early pregnancy. That will be the reason. So we have to understand how mutation takes place. So mutation can take place at any level through anything, but there are types of mutational disorders. So in some mutations, there will be substitution, that is like a pattern of genes, the pattern which is there, that proteins, the way they are being arranged, all those types, something gets substituted by someone else. Like 1, 2, 3 is it has to be a pattern is 1, 2, 3, 4, 5, 6. But what happens in substitution is 2 is replaced by 5 and 5 is replaced by 2. So there is substitution. In deletion is what? If it is a pattern of 1, 2, 3, 4, 5 number gene is not found. So that is called as deletion. And insertion is when something extra ends it. So that is 1, 2, 3, 5. 1, 2, 3, 4, 5, 6. So one extra 5 is being added. And in inversion is what? 1, 2, 3, 5, 4, 6. So the pattern is completely inverted, right? So this is inversion. So accordingly, the mutation will show its impact. The most syphilitic, I'll tell you, the most syphilitic is deletions, right? Because in deletion, when one gene is absolutely absent, it will cause some great syphilitic disorders, because that protein will not be formed and completely enable of that protein will be a problem. Insertion is something adding to it, right? So this is somewhere giving to you some diseases like Downs is also an insertion, because in Downs what happens is key at the chromosome number 1 there is an extra chromosome which is added to the genetic material, and so therefore it is not a complete destruction. It's not a complete destruction, though it is a mutational disorder. You will find that there is something extra. So when you talk about something extra, psychosis adds to it. Therefore you will see key in Down's children, you will find them having certain great capabilities also, which are there in their intellectual capacity. So they look very normal, they can perform very good life, but because of the mutation, what happens is they lead some abnormalities into the life. So I don't say that this is psychosis, but definitely this is not syphilitic. This is psychosyphilitic. But psychotic element is only coming, don't take psychosis from that end. I'm talking about because something extra is added, right? Something extra is added. That is the need of the mother, that she wants something extraordinary in that child. So that mutation is an extra chromosome adding to it. Now, if we go ahead and understand Downs, so you should know ki what are the symptoms, causes, diagnosis, and treatment of the Downs children. You will see that these Downs children are really very affectionate, very timid, and when you see them, you are able to recognize them because they have got this spatial features, that they have a flattened nose, the tongue is fissured, they have low set ears. And when you talk about the facial features, as we all know, the low set ears, if you see the eyes and if the ears are below, even in normal condition, if you see the low ears are low set, you will see that they are baritas, they are calcareas, they have got a poor intellectual capabilities. They cannot interpret, their mathematical values are very low. And if you have seen the idols of Buddha or Mahavir or any other persons who are very highly intellectual, you will see that ears are really very large. And in Buddhas and all the peoples who have attained divinity, their earlobes used to even touch their shoulders. If you will see minutely to the idols, you will see that their ears are very long. So these ear lobes are also indicating a good intellectual capacity and even alertness. So when you talk about low set ears, it is definitely a quality of low intellect. Then a short neck, because they don't have a neck, or they can have also got a very small neck, right? Then they have up slanting palpebral fissures from the lateral side, and lower side is being slanted. They also have typical eyes, and the tongues are fissured. Even at the hand level, you will see that they don't have that good muscle strength. The muscle tone is very weak. They have got a typical smile. When they smile, their eyes also get small, and this is a very special feature of Downs. When they smile, they have got a very cute smile. They are very affectionate and kind children. Maximum people you will see ki with Downs, they are very friendly, because that psychosis end is added to them. They want to get social, they have got a good social life, they have got inclination to learn singing, dancing. They can be tamed very easily, and they have got a capacity to learn also. So when you talk about physical features again, the fingers are very small, thumb is very much broad, widely separated first toe. So this is all a typical genetic character which they resemble when the chromosome 21 is affected. So this is all happening because the blueprint from the mother is being transferred, and they have a genetic presentation. And as we all know, Down syndrome is one of the most common congenital disorders as a mutational disorder which is coming up. And even the government is trying hard that Down children should be reduced. So they have early screening processes, and they recommend that since it is a Down child, you can plan to abort also. But few parents, they don't agree to it, and they really want these beautiful children to come into this world and enjoy the happiness. But since it is a mutational disorder, it is never coming alone into the palette. It always comes with many neurodevelopmental and intellectual disabilities, also developmental delays. You will see maximum children are having speech delay, fontanelles not getting closed, the body is not getting developed, the height is stunted, the growth is stunted. You will find them not gaining the optimum height, the reaching the optimum value. They are not very social in that way, not very confident, so they have certain behavioral disorders, and they go into early Alzheimer's also. And few can have convergence, you will find I have many cases of Downs where they are combined with congenital heart diseases also, where the life is also at stake or life was also being threatened. So many musculoskeletal and other disorders also getting associated. These children have got frequent tendency of falling sick and getting frequent respiratory diseases, and also they get combined with other autoimmune diseases also. So this is a whole feature when you talk about it is not a syndrome, but yes, it is combined with other diseases also. When a mutation comes in, when syphilis comes in, it will get combined with other diseases also. So they have so many issues which are coming up because of loss of tone at the abdomen. So there are umbilical hernias which are there, congenital disorders, they have enlarged colon, and everything will come up. So when you talk about Down syndrome, you need to know that Down syndrome is divided into three parts according to the type of mutations it has. So the first is the most common type is trisomy 21, and this is the most commonest, affecting 95% of all the Downs cases. You will see that is trisomy 21. So they are the typical trisomy cases which you will come, and you will know ki this trisomy is where you will find that in trisomy, I will take ahead what happens exactly in trisomy. The second part is translocation, which affects 4%, and mosaicism, which is really very rare in Down syndrome. But if it occurs, it's a blessing to have a, if someone asks you ki I am giving you a Down syndrome child, which child you want to adopt? So either go for trisomy or go for mosaicism, because mosaics child are actually almost normal. They even get unrecognized in Down children. So if you talk about psychosis, you talk about SORA, you talk about syphilis. So mutation in mosaicism is not that gross as much in translocation trisomy. Okay, so the pattern is perfect, and how they vary is we need to understand. Ki since trisomy is affecting 90%, and it has got a pattern that every copy will have three copies. It's a pattern. So 1, 2, 3, 4, you count all the cells of the body and you will see ki they will all have a trisomy into it. In mosaic, it's a rare form, and it is because there is an extra copy which is there. What is mosaic is not having a pattern, not having an order. Like in 21, you had a pattern that every cell will have. In mosaic, maybe that this cell will have, other cell might not follow. Third cell might not follow, fourth cell might not follow. So there can be like in out of 100%, 80% are affected because of trisomy, and 80% are not affected. 20% are not affected. And depending upon that, the features will get affected. In translocation, it is like it affects 4 to 5% of the population of translocation. And when you understand them, key causative factor, so most important character is that they say ki when it is a elderly primary matlab at a very later ages when Down syndrome is increasing, because the mothers are not agreeing to go into conception early ages, and they are going into conception after 30 years, 35 years. So the chances increases that these women will give birth to all these mutational disorders, because now the genes are not ready for the birth. They have shifted their gear, because early the chances of getting a healthy child. But as the age advances, even the changes are happening at the genetic level. So therefore, please promote your patients, please promote everyone around you that they should get married at an optimum age and get conceived at an optimum age, so that infertility and such mutational disorder, the chances of getting into this is being delayed. At least you can delay all these things because you're not an elderly primate. So the career risk, see, if you will see here, if the father is carrier, then the risk is about only 3%. But if mother is a carrier, then the second child will be 10 to 15% chances more. And then 80% of children with either trisomy 21 or mosaics are born to mother who are younger than 35 years of age. So it is also possible that it can happen in early also, but late pregnancies is one of the most accountable causes for Down's children. So mother's pregnancy history, as we all said, key the fetal development is in the first week of pregnancy. So in pregnancy history of Down's children, as we have already talked about the right seed soil and right seed and the right soil, because it is a mutational disorder, the meiosis process and the mitosis process which is taking place. So when the chromosomes are actually dividing up at that time, when a mutation takes place, this will give birth to a mutational disorder. And therefore, when you talk about a causative element, it has to be, even when I'll add something to this, is that you all know that this process of conception is a miraculous plan, and even God doesn't want that mother should also be aware. It is a superb bond, बोलते हैं ना, मतलब ये सबसे सीक्रेट प्लान है यूनिवर्स का, to give birth to a child. This is a miracle which is happening. So all these secrets have to be very secret. आपको भी पता होगा कि जितने बड़े मिशन होते हैं वो उतने ही सीक्रेटिव होते हैं. They are not exposed to the world. It is very rightly said कि before you execute a plan, don't reveal your plans or don't reveal your thoughts to the universe. First do it and then share it. Don't share your plans to everyone, because it will not happen. Similarly, the universe doesn't share this plan that now the mother is conceiving, and therefore it is a top secret which is there, and that top secret is happening in the fallopian tube. And even the mother is not aware कि now I have conceived. So this top secret plan is up to what stage? You all know कि this is first week of pregnancy. So whatever mutation is happening is have to happen in this first week of pregnancy, and that is what where the mother is not even aware. So when you take a history of mutational disorder, please ask कि pregnant हो तो उसके पहले के 15 दिन becomes very important. That is the first month of pregnancy. So when the UPT came positive, even before that, something has happened which was wrong, right? So again, taking ahead, am I clear with this point? Because this is very important when you're taking a congenital anomaly or mutational cases. So when you talk about genetic mutation, you talk about syphilis, you talk about the ailments from what the child has got affected. So the thought process which the mother has suffered and what the constitution has affected. So when you talk about this approach, you have to take the mother's history equivalent to the constitution of the child. So when you talk about trisomy, as I have said, trisomy is what? One extra limb getting attached to the chromosome 20. So this is one thing extra. So you will see कि Down syndrome, when they are trisomy, you will find Down's trisomy are very psychotic children, very timid, very affectionate, very social, very fearful. They are tamed very easily because that psychosis gets added to it. Even high intellects will also come over here. And in trisomy 21, the most important thing is कि all the copies have got a triplet. So something extra. So whenever in life the mother wants something extra coming to it, right? So 95% are of this types. And also you will get a history is that, see, please pay attention to these two slides because that is the crux of the whole case taking what we are going to take. That this trisomy is very important to understand is कि this is an extra genetic material which is affecting each person differently, because it is not possible कि every individual will have the same genetic decoding done. So this extra genetic material will have an individualization which will affect. This is not me. I'm not giving it from my end. This is there in the genetic books. They say कि even if it is 21 which is getting in all the genes, but still every person will manifest it in a different way. This genetic material will affect this person differently. So no two individuals of Downs can be exactly similar to each other. So this is what the theory of individualization can be seen in mutational disorders. Ki no two individuals of Down syndrome can be treated as, like, you cannot give the same remedy to all the cases, because here again, ma'am, Downs में कैसे individualization देखने का? मैम इसमें कैसे PQRS देखने का? दैट इज द पावर ऑफ होम्योपैथी, दैट एवरी इंडिविजुअल इज डिफरेंट, एवरी कॉज एंड इफेक्ट हैज टू बी कनेक्टेड इन अ very different way. So some individuals will have a good function, will have some will have good intellectual capability, some will be like, if you have a Baraita as a person coming up, you will have poor intellect. If you have, even I have remedies coming up like anacardium, which was given to a child, then I have tarantula also. So you will have different capabilities which are coming up. I have a down child who is really very good as an actor, right? Good at stage, so you have a remedy like that. They are very affectionate, so you have phosphorus also coming up, so you have variety of remedies which are given. So that is what power of individualization will be. So it affects, it comes with other combinations also, like I have a case where it was downs coming with congenital heart disease, and that child, when he was brought to me, he was of 6 to 8 months, and the child was being sent that we cannot operate this child, it was a large VSD, and the child would even go into cyanotic spells, and those cyanotic spells used to be very threatening, and the mother was advised that we cannot operate this child because he has got very poor weight and very poor prognosis, so please take the child. Once he is 1.5 months, 1.5 years, if he survives, we will treat the child. So this was the condition. That child was brought to me, and with our medicine, the miracle was that within a month, the cyanotic spells had gone. The child had got a good survival, and after few years, the mother went back to the doctor saying that now the VSG has reduced, but still it has not closed. So now get operated under some pressure. But this is what individualization can be, and the remedies do vary with the presenting complaints. So when you talk about mother state during a trisomy, I'm talking about trisomy. The first important history in all the downs you will get is there is a previous history of abortion. In maximum, if I have seen 25 cases, in almost 23 cases, there was a previous history of abortion in the mother. The abortion, the cause of abortion can be any cause, right? So therefore, this mother state, yeah. So that is one extra. So you get a previous history of abortion, which is there in a maximum trisomy 21. This is for sure. And therefore, when you have previous history of abortion and that abortion is within 3 months or within a year, and even the mother had suffered because of that abortion. It is not like just abortion. No, it is not like that. The cause of abortion can be anything. There can be even recurrent abortions which have happened. And because of that loss, the mother goes insecurity. So the word for trisomy is equivalent is that something extra. It has to be a psychotic ailment. So the causes are fear and insecurity are the key words. So there is delayed conception. So I want a child, that intense desire that I want to conceive, that intense desire that I want to, that is psychotic element, right? That I want me and my progeny, right? I want my progeny. So I want to conceive, but it has been so ages that I am waiting for this conception to happen. And that desperate conception still gives you that thought ki yes, there is some disorder. So there is lot of insecurities which are there in the motherhood, that insecurity that I might even lose this child because previously I had an abortion. So this is a precious baby for me and I want to protect it. So that is again one extra thing coming up. I want to give extra care. I want extra clinginess to the child, and therefore the child of downs, you will see they are very clingy to the mother, they are clingy to the things. I have seen a child that he was very clingy to soft toys. They are very soft hearted children who want everything should be smooth, soft. They would like to play even with soft toys. If you have soft clothes, the child comes and they just play with the child, saying it's so soft hair, so everything they want soft. Even structurally, their palms and sole, if you will touch the skin of Down's children, you will find it is more of fatty thing or soft thing. So lot of insecurity which is imbibed in the mother, and that previous loss of the children. So again, a loss, that anxiety, that fear that I might lose this precious pregnancy again. So that also is one of the contributory factor for trisomy. So the children become clingy, they have fear of separation, so they are timid, they are social, they are affectionate, they want love, they want what ailment comes, they want more of love. So you will find more of affectionate children also coming in Downs. So there is anxiety for the future, there is anticipatory anxiety, lot of fears which are coming into the mothers, thought that I might lose this connection with the child. There are lot many states in pregnancy you will find that the mother feels ki there is no one to take care. Since we are living alone, there is no family around me. I have lost my parents. I don't have anyone to support my family. So that fear that I might be left alone in the society, there is no one to take care who will this pregnancy might harm me. So those fear, I'm not responsible, I cannot take responsible, still I feel that I'm not grown up. So all those thoughts are also there. So they feel that they need support, they fear that they will lose support. Yeah. So anxiety future about that, who will take care, then fear of responsibility is there, then they feel that they are not yet ready to take up the motherhood, so they just delay the conceptions. So you feel that they are being, they have that fear that I am not yet prepared to be pregnant, and now I have got a child, now what will happen in the future, who will take care, who will support the child, I don't find anyone around me. So when they are not prepared for the pregnancy, so they just have a rejection. But actually in Down syndrome you will find that these mothers don't take pills for abortion, you won't get that history. They have rejection, but that rejection is not that intense desire to just abort the child and get rid of the child. There is rejection for pregnancy because of that fear of responsibility or fear that there is no support. So they don't actually, I have not seen Down children that they have taken abortification pills. If they have taken abortification pills and still the child survive, it goes to more of MR and CP children, more of mental retarded children because of some other congenital anomalies, but not because of Downs. Because in Downs children, the mutation is far beyond before the mother gets aware. So therefore, abortion pills are when they can take an abortification pill is when they get aware that they are pregnant, right? So when they get aware they are pregnant, and abortion pills are taken usually in the second month or when they are already progressed their pregnancy. Whereas this mutation has already taken before. So you will not find any history of taking pills to just get rid of this pregnancy. So there is rejection which is going on because there is a dual situation. They're fighting with their own self because somewhere they want to get pregnant. But then doctor says, oh, you are already through that age. So already they have been struggling because of this motherhood since so many years. And therefore, when they get pregnant, there is some duality situation which is going on. And because of that duality, due to that confused state, they develop this Down syndrome. So am I clear with trisomy? So trisomy, by default you will have a history of abortion, by default you will have fear and insecurity, but this fear and insecurity is not only psychotic but go to that syphilitic level, that it goes to the delusion level of the mother. So they will feel that they will lose support, and they have that fear ki no one is there around to take care. Now coming to the second type, that is translocation. So in translocation mutational disorder, when you see what happens in translocation, as we have seen in trisomy, exactly translocation में क्या होगा? Few part is getting translocated and from one part gets disconnected and get translocated to something else. So there is no transformation as such, but definitely the proteins are getting changed because the genetic material जो जहां होना चाहिए था, ट्रांसलोकेशन हैज टू बी अंडरस्टूड. ट्राइसोमी को हमने कैसे अंडरस्टैंड किया? वन एक्स्ट्रा, one thing extra added to 21, that is 3 triplets, right? But in translocation, it has to be understood very well. It is trans, something which has to be supposed to be there is something not there. And it is being misplaced. Something is misplaced, right? Translocation is something being right? So please understand the words which I'm using, because that is what you will take in these cases. So something is misplaced, is not in the right place. That is translocation. Okay. So something not in right place. Okay. So there is an extra genetic material. It may not be full and separate chromosomal piece. That is what I'm saying. It is not a full and separate piece. It is something, a piece attached to one or the other full chromosome. So something is misplaced, right? That extra place can be actually attach itself to any other pair. It is not exactly 21, but 21 का pair जाके 13 पे, 14 पे या 15 set पे जाके attach हो गया. So this is something which is hereditary. So translocation is hereditary. Trisomy is not hereditary. When you talk about trisomy, you will not see into the family ki some of the parents are Downs. But in translocation, if you see, even if you don't have a genetic report in front of you, in today's lecture, you will find that genetic report will be automatically in front of your eyes. So if you see, it is more of psychotic features, more of a pattern which is being running up, and there is a strong history of abortion with no family history of Down syndrome. It is trisomy 100%. Okay. In translocation, you have a genetic history ki one of the parents are carrying the genes of translocation. So whenever a translocation comes up, please go. See, this is what predictive homeopathy also teaches you. What will be the prospective now? When you know that it is trisomy, don't go for further genetic history of mother and father. You might not find, because it is not genetically getting transferred from one, or it is not inherited. It is because of that chromosomal mutation which has taken place. But if you find that this child is coming to you with translocation, है ना? And the genetics history says it is translocation, then please request the parents, before you plan the second baby, go for a genetic study, because then parental genes are carrying this genetic disorder into their inheritance, and this is hereditary. Okay, but this is the only type which is hereditary. So translocation is more syphilitic, and when a translocation case comes to you, whenever a translocation case comes to you, go to Mahakaran, go to the history before the conception, the 3 months before the conception. You will find in translocation ki that has got a karmic baggage coming from one generation to another generation. So the cause has to be beyond the conception. That is something, a super causal or something, a spiritual cause which is getting transformed from one generation to another. I have not, this is what I have studied through the cases, and this is damn sure कि this is 1 plus 1 is 2. So everywhere I've read about the literature of translocation, it says कि this type can be hereditary, and when they are born with Down children with 30%, 3 or 4% translocation, the parents' chromosomes are studied to understand it is inherited or not. So if it is inherited, then the second baby might also get a chance of getting Down syndrome. So this is a prospective. If it is a translocation Down syndrome, go for parental screening of chromosomal study so that it is not transformed to another. So if a case comes to you, ki ma'am, I have a Down child. So if it is trisomy, tell them, bindas, conceive for the second baby. You will not, that is for sure, that you will have a 100% normal child. But if it is a translocation, be a little bit cautious while giving words, because the genetic material can again get transformed, and 50% chance can be possible that other child will also be a Down syndrome. Am I sure? Am I very clear? Because translocation is something misplaced. So something syphilitic, higher reasons are coming into translocation. So when you are cracking the case of translocation, you need to understand that translocation is not something which will come only after fear and anxiety or fear or insecurity. In translocation, it can be hereditary. Identify the cause in generation, right? Before or during conception, है ना? Because it is a misplaced attached, this is very difficult to cure, because it is not only this child is suffering, this child is being cursed from generation. So delusion of being cursed, this is an energy which is being transformed through generations. Therefore, when you treat trisomy, they're very difficult, very easy. Trisomy 21 is very easy to crack. Also, you get so many psychotic symptoms, you get sora, and easily you get out of the child and the child gets stable. But in translocation, it is really very difficult, because this is syphilis which is peeped in from one generation to another. So you have to go to that third generation, second generation history, and then crack the case. So go more deeper and identify the rubrics related to identity. Are you getting me? It is identity. I told you in the beginning of this lecture कि when you talk about seed, it is identity. So this is not the soil of the mother, but it is the seed which the parents are transforming. So go more deeper. You will get delusions of being cursed, misfortune inconsolable. So all those thought processes, ki I am not only suffering, but my whole generation is suffering. So all those deep penetrating rubrics will come. So existence. So when you talk about translocation, it is identity and existence. So when you talk about translocation, it is identity and existence. The rubrics of identity and existence will come in. Now, when you talk about mosaic, as I told, mosaic is something where it might follow a pattern and few genes will be normal. So one is normal, the other might not be normal. So that is some haphazard thing coming up. Something which is hysterical, right? Something which is not following a pattern. Okay. So this is syphilitic, but this is not syphilitic. Some are following, that is hysterical, something very hysterical. So you will something which is missed also. Mosaic is a genetic disorder where they are not even identified at birth. Mosaic is identified when the child is not able to speak, not able to communicate, or even in later parts of the life, they are so normal in appearance that they get missed. So it is not that these are the cases that physical characters, it is difficult at first glance and they get missed to undiagnosed and they get delayed milestone, and that time they are being diagnosed. Okay, so mosaic is something related to something haphazard, right? Not following a pattern. Okay, so almost normal and less destructive, because at least you have some genes which are normal. So if it is a genes which is normal more, they will be more normal children. If you have seen Sitare Zameen Pe, the girl who is very hefty, I think she is mosaic, because hardly she could be identified. Her speech, her speed, everything is very good with good intellectual capacities. Therefore, the children over there might be a mosaic child. So identify the cause is after fertilization. So here the history is after conception, the initial 15 days to 25 days is very important in the causative element of mosaic. Then there is an aberrant. Is what? Aberrant cell division is not following the pattern. Some follow, some not follow. So there is confusion. Okay, so there is confusion. करना है नहीं करना है. So when you take mosaic, you will find that lot of intellectual rubrics will come up. They have got good intellect also. So consider delirium over here. In translocation, generational causes, generation level पे जाके delusion, mosaic में deliriums. So can have good intellect, therefore there is confusion, right? So you have to, in short, when you are understanding Down syndrome with the three types, see, this is what the importance of right seed, soil, and season is. So when you talk about seed, translocation comes up. When you talk about soil, mosaic comes up, right? And when you talk about parental things which are coming up, it is really connected to the genetic material being transformed because of some defect which has recently happened, like abortion which has happened in trisomy, right? So it is the like a season. The sir would always say, for a tree to grow, it requires a right seed, right soil, right season. This is nothing but your aphorism number 32, which talks about susceptibility. Okay, so you have need to have that susceptibility. If you have defect in the seed, you will get all the mutational disorders, all the congenital anomalies. If you have defect in the soil, you have disorders which are coming up in the later parts, like related to physiology, related to higher functions and season. Again, that is higher functions which get affected. So everything plays a very vital role in the normal development of the child. So now you can connect to me ki how we started the whole lecture. We started from the mother's womb. Before that, the genetic material which is coming from the father side. So how mother father becomes important, how the environment in the family becomes important, how the right season is nothing but the environment around the family. The mother should feel secured. Mother should feel safe, security, that yes, I am protected. I should be, I have that love and care and affection in the family, and everything is balanced, right? So, if this is balanced, only then the sora grows and you get a beautiful tree with all the fruits coming. Any breach over here will give a syphilis and the growth is hampered. Am I very clear? This is applicable to every cases coming to you for hopeless camps, or any cases coming to you with congenital disorders or anomalies or any diseases related to mutational disorders. Am I very clear? Even if it is DMD, which is shown in the later parts of the life, even if it is in the later parts of the life, still this seed becomes very important. Therefore, mother's history becomes very important. So, as we have seen, all the three types have all three features. So, this is trisomy, this is translocation, and this is a mosaic. So, you can see the mosaic girl is almost very normal in her life and she can lead a very normal life. And translocation, you will have a strong family history. And trisomy, you will see very commonly around you. And all trisomy have got a strong history of abortion. So, this is the key to unlock the case of Down syndrome. So, in short, if I summarize the whole lecture, so in trisomy, there is aberrant cell division when the sperm or egg are developing. Okay, when they are developing, so the history in trisomy is before the conception. So if you take trisomy, so it is before the mother comes to know about pregnancy, and beyond that is before 3 months. So you have to take in trisomy is not the pregnancy history after the conception, it has to be before the conception. In translocation, it is genetic, so coming from the genes. So take the history before or during conception, and in mosaic, it has to be an aberrant cell division, some are normal, so it is after fertilization. So this is summarizing it, and summarizing the cause again. In psychosis, trisomy, it is insecurity, protection, and fear. In before or during conception, in translocation, it has to be that delusion which is coming from the generation, and in mosaic, it is the delirium which is there. So now coming up to the prescription part, the potency. So because this is a mutational disorder, high dynamism is there. So please go for high potencies. Yesterday, while reading the cases, I understood that wherever I've used high potency, the results are very dynamic and really very beautiful results we have got. Low potencies are very slow to act, and sometimes we have not even got the results. So understand now that when we have talked about the mother's history, now even because they have got each Down syndrome is an individual, right? We have already understood that this is power of individualization, and every constitution suffering from Downs needs to understand what capabilities they have. And according to their own constitution, the remedy has to be arrived. So, when you are treating the Down syndrome, then two things have to be considered. Is number one, understand the conflict the mother has suffered Second, combined with the disposition of the child. Here, the disposition of the child has to be combined to understand what constitution has suffered this Down syndrome, why that child has decided to be born as a Down. So, if I'm really clear, we will go ahead with the cases which I have taken up to understand the whole process, the whole journey. If any doubt till now, you can put up in the chat box. We will take it in the later half. So, taking ahead, the number one case is of a small child. She's brought to us a 1.2 years female child with Downs. She had a subaortic VSD where the VSD was very large, 8 and with left to right shunt. So when she came to us, that was a sinuous look. You can see the features which were very prominent, and the child was definitely preterm. When she was brought to us, she was unable to sleep, sit also, she was unable to do anything in her life, and she could not do anything because all her milestones were also delayed. The mother also had a history of severe oligohydramnios. So you understand from oligohydramnios again, when you see oligohydramnios, that the mother is somewhere not ready to give nutrition to the child, right? Because what is hydramnios is the placenta, is the fluid which is there in the mother's womb, which give nutrition, right? So that nutrition is being given to the child because it has lot of proteins into it, right? Amino acid is abundant into it. So if you find oligohydramnios, you know that the mother is not ready to give that sufficient nutrition to the child. So that bond between the mother and child is somewhere missing. So now we know that this is trisomy 21, and also we know that this is a perfect example where from this page we understand that this is oligohydramnios. So definitely the bond between the mother and child is somewhere broken up. So go to the history and take it. So this was the genetic report of the mother which we had got. So it is trisomy 21. So mother's pregnancy history says that she was a girl who was born up in a lower middle class family, but she had a very strong history that she was a working lady. And what happened is she had convulsions during pregnancy and before pregnancy also. So she was under some medications. So she was a aggressive lady and an angry. She said that I was a working woman. I was a person who had certain identity and even a teacher who had to leave everything for the pregnancy. She also says that I had conflicts with the in-laws and husband was not ready to for pregnancy, so he was forcing me to abort because the financial conditions of the family was not very good and it was an arranged marriage. So she was like he said ki I don't want a family right now because I'm not yet prepared to be pregnant. So she said ki even I had that insecurity. Now if I get pregnant, I had to leave everything. I won't be able to support my husband. And she said ki we really went to go for abortion, but we did not get successful, and everyone was in that stressful mode. And the situation was that everyone was forcing me to do just job because that financial need was there. You should study and you should help even the family. So she said the words they used to use were very painful for me, and I was like very difficult now how to handle all this stress. So they would also give me physical abuse and will not give me proper meals. So I was feeling like I had no support in the family, and they would also use ki you are not of any use to us because you are not performing any job or anything. And it was a very insulting environment in the family, and even they would say ki they have not accepted me as a daughter-in-law because it was a love marriage. Sorry, it was a marriage out of the choice, and it was mother-in-law was somewhere not agreeing to this marriage, and it was somewhere like they used to insult me and abuse me and even not give me food to eat. So there is insecurity, there is insult, humiliation in the family, and because of which there was lot of anger in the mother. And during pregnancy also, in 1 month, she had to start work, but because of all this she had to quit. So everywhere there was stress and there was no support. She said she had to start work, but because of all this, she had to quit. So everywhere there was stress and there was no support. She said की आपल्या परिवाराला तुझ्यासाठी झोपासाठी करून दिले म्हणे. मतलब what she meant was की marriage is not only to have sexual relationship, but we expect that you should even support the family, and we are not here to just give food for you to eat. So you need to work. But the problem was that she is not able to work and she would feel very lonely and she would just cry. And this went on, that anger which was not there, and she felt insulted. And that anger was not expressed so well. Everything was expressed on the husband. Till 2 months, she said ki I felt some attachment to the husband, but since his behavior and the in-laws were not very well, I was like ki I was not feeling that attachment even with the husband, and there was no support. So she shifted to her matlab native place in the later half of the pregnancy. And she also came to know in the pregnancy, before the pregnancy, that because of all this situation, the husband has flung to some other lady and the husband is cheating upon her. So this was the whole situation, and the child was like he said ki the whole situation was like ki, I wanted to end my life. So this was very syphilitic thought, and there was lot of hatred for husband because he had already flung with another female and he was not taking proper cure. So husband was cheating upon her. But then the thing was ki I got married, and within 3 months I got conceived. And one more event happened was there was an eclipse, and the conception was during the eclipse time. So people even scared me ki you were exposed to eclipse, so therefore there will be genetic abnormalities into the child. So as a female, I used to feel ki what wrong did I do? Is it my greatest mistake that I got married to this male, which was wrong for my life? And I felt ki this was my biggest mistake of my life. And this is the feeling state. What she said is ki this was throughout. And if you see the child, you will find that the child was very timid, not allowing anyone to touch. And whenever someone, even my assistant, was going close, and she would just hide her face and just go behind the mother, and continuously cranky child, and crying, and every time she was just crying, and there was nothing which was possible. So there was profuse perspiration also in the child. So the thought process of the mother is that she was suffering. The suffering was to the level that she felt that what crime did I commit that I have to suffer in this life? And she was crying bitterly even in front of me. When I asked her, ki, what do you feel? Ki, why did you have, go and ask this question to the mother. Ki, do you feel that, why do you feel that you have got such a child? Then you will come to know that mother will definitely express this feeling ki हाँ मला सब I feel that I have committed some crime and therefore I am being punished because of this. So this thought process was very deep, and she would constantly repeat, I have done something wrong and therefore my child is also suffering. I have done something wrong and therefore I got such in-laws, I got something. So that was a feeling which was being imbibed, and there was lot of sadness which was there in the child's face. The child was not affectionate to that way. The child was withdrawal child, timid child, and therefore that sadness rubric becomes very important. And it was not humiliation was not that much affecting her. She said ki I have spoiled my whole life. I was such a good person, I could have done good job, I could have been independent, but just because I got married, I agreed to getting married, and I married to a wrong person. This is the biggest mistake of my life, which has spoiled and ruined my whole life. So that was a deeper thought process rather than just taking that I'm being cursed, I was humiliated, mortification. See, mortification to what level? If she felt that mortification, then only it is mortification. Then only you can take mortification. But it was more the feeling that she was not reproaching others. She was reproaching herself that this is my mistake. Me kaitari wrong केलं and that is what the mistake I have committed in my life. So there was a sadness. There was sadness that criminal as if she was greatest. This was a more syphilitic rubric. and therefore the remedy which was prescribed to this child was cyclamen, and this cyclamen has beautifully acted upon the child. And if I'll show you the video of this child, see, this is, can you see video nahi dikh raha hai na? See, this is the child. I hope you can see the child. So this is the child who came to us on 3rd June 2025. So this is where the child was brought to us. You can see the child was hardly able to do anything. She was able to only turn herself on 3rd June 2025. There were no activity, there were no motor activities. She was not able to sit also. And after we gave her cyclamen, then on, this is October where we got the results. This is 6th November 2025. The child is able to play. The mother was so happy and delighted. So this is what the case is. And so coming back, this was case number 1. And the remedy which we gave was based upon the sadness, because this was the delusion which the mother had. And for the great surprise, I'll tell you, after we gave cyclamen to the child, even we could feel that the relationship, mother was so happy that she said ki even there is improvement between our relationship also. So when you give a right remedy, the remedy brings a whole change in the totality. And even when the things were being analyzed, he said that the improvement was dentition had started, which had stopped. Even the head circumference has increased. She was very cranky and very irritable before, and after the remedy, she has become very calm. So there was eclipse also, there was disconnection. If you talk about the congenital heart disease which she suffered, so that was something which has happened because the disconnection between the father. See, VSD is what? During conception is not the problem, is when I couldn't see the problem of VSD is what? Ventricular septum. The septum has to close, but that septum closes just before the pregnancy and when the child is about to born, and that septum just closed so that the shunt is not there. So the cause of these septal defects or the valvular heart diseases are not exactly when the valve is present, but this valvular septal defect is when the when the septum fails to close, right? So the cause was already there, that she felt disconnected because during her later phases of pregnancy, she said she came to know he is being cheating upon him, and from there she felt that there is no attachment with the husband. So this was a case where we have taken, and now I have advised her that after a year or after at least 6 months, we will go for going for the 2D echo and understand what changes have happened at the septal defect, and we will definitely share it. This was a very recent case, and just wanted to share this case because the way the whole family has changed. We can see the bond also changed. The mother was very happy. The happiness was like she started expressing her joy, and she felt that after the child has improved, my life has also improved, and even I am feeling connected to my family. So this is the change we can bring upon by giving a right simillimum. So this is where she felt more syphilitic rubric is sadness, and where I went for cyclamen was that she felt that science wala part tha uska, कि if I would have not married to this person, my life would have not been ruined. So delusion doomed भी आ सकता था यहाँ पे, unfortunate भी आ सकता था, but where was more important was when she started blaming herself कि it is not others. She never said कि it was my wrong destiny. It is like I selected this boy, which was wrong, and I got married. So this was my biggest mistake. I left my job and I started getting conception, और वो वाला जो thought आया, इसीलिए we took it, because whole story changed once she got married. See, it was within 2 months of marriage that life had changed. Before marriage, things were very different. After marriage, things started changing. They started comparing, they started compelling her to go for job, earn bread and butter. There was so much of humiliation and mortification in the family, which was there. And this thought process that I have committed a crime, and therefore, when I'm being forced to get pregnant, now I don't want even this child to happen, but I am so helpless, I cannot even abort the child. So there is rejection also, there is everything. But when everything was analyzed, she was continuously crying. I did not read the whole story. If I would have read the whole story, you could have connected ki what has exactly happened. There were so many events she had explained in the whole case. But moral of the story was that she was constantly blaming herself for getting into the wrong situation in life. And it was not that destiny, but it was herself, that I am a sufferer because I have to suffer now. And she went into that gloomy phase, into that indifference and sadness. And she felt that I was really not attached even to my husband. I did not feel any emotions. But doctor, after giving this medicine to the child, I don't know why, but there is a bond which has started developing between us. So this is what is there. So now this is a case, a second case of Down's again child. The child was 4.5 years when the child was brought to us, hyperactive with no speech, delayed. Almost few words the child can talk, and the milestones are all delayed. There was a history of dengue and many other illnesses, and there was extreme delayed milestones. He was overweight till 10 months of age. So as a child, he was very restless. Her mother says he never gives trouble. He keeps playing with utensils, ropes. He is very obstinate child, but when we try to explain him, he's cranky. He's not very cranky and consolable child. He is very affectionate, loving for family members. He keeps on kissing, hugging people around the family, but not to the strangers. But yes, if strangers approach him, he will give a sweet smile. I will share the video. You will see the sweet smile on the face of the child. And he's very good, but he is a very fearful child who has fear of dark. And mother says ki even in the night the light is off and everything is like he gets restless. He will start moving here and there, and he wants, even in the night we want that light should be on if he's fast asleep also. So whenever he's alone, he will start weeping. He doesn't want to be alone. He wants everyone to be around. And he loves even strange, even guests coming to our place and going to the marriages. So he is very particular about the things. One more thing is, because psychotic elements ends up gets attached over here, you will see that these children are really very meticulous. If you teach them one thing, they will do that thing in that order, in that place, in that way. So they learn thing in those patterns. They learn thing in those methods only. So if father keeps anything here and there, he wants everything. You will see a down child will come to you in front of you na. Agar usne aake in your clinic he has seen ki this remote is kept over here. If it is somewhere here na, they will come and keep it in order. I have a down child. If I don't examine him, he will, like, he wants that I should first examine his tongue, then I should examine his chest, then I should keep the torch back into the drawer, I should keep the stetho into the drawer, then I have to take the pen, then I have to write it, then he will guide me, he write it down my name, then he will take the paper and go and give to my dispensing unit. So they are so particular about the orders. It's been years together, and he, if I forget, matlab now I don't need every time to see the throat, everything is good, I don't want to check the child, but it has to be a compulsion, because without that he will not leave my place. So that is what they are very particular about the things. So they can even operate. See, we know that these people have got some intellectual capabilities. So the mother said ki meko mobile nahi chalana aayega, but this child can operate. They understand hunger. She said ki he's even toilet trained and goes to school, take care of his belongings, he never misses anything, and he is a very affectionate child. And in school also he will sit quietly and not bother the teachers. Mother said ki this was one of my pregnancy where she already had a late conception. The history of pregnancy was that she was G3 P2 and A1, because there was a very bad gynec history over here. She already had a daughter which was 12 years. That conception was also late after 3 years of marriage. And this community, in her community, she said ki for us it is very valuable that I should get early married, but because of some reasons I got late marriage. Then after late marriage, again late first pregnancy, and that also in 2014 when I had a son. The child died immediately after birth, after 1 to 2 days, because there was some septicemic condition in the child. And because of this incidence, continuously for 2 years, I was in a grief state. Third, again, an abortion when I tried to conceive. And a whole state, I was into that grief state that how did I lose my child? And that was my precious baby. And there was a lot of pressure for me that I should have a male child. Then somehow I was not ready to conceive, because that was a very painful time. And I was like, I should not have another complaint of having another child. So this was a fourth conception. So you see the history of abortion, the history of insecurity, fear, which the mother is carrying all through the pregnancy. And she said ki for the whole years, throughout the year, he was born in 2018. So 4 years, matlab from the son born till 4 years of time period, she was continuously under that grief phase, under that sorrow phase. For 2 years, she said, I could not even step out of the home. So this was where every thought process was being activated. And when she conceived this, already her age of pregnancy had been very delayed. And she said ki I was not actually prepared for this pregnancy because I had so bad time before. So this was an unwanted pregnancy, not unwanted, but there was a pressure that if you conceive, you should have a male child. But that was not, I could understand ki they demand a male because there was a daughter. So I did not take this to my head. But more important was ki I have lost my son. So I did not want to lose another child. So that insecurity was deep down. And throughout those 4 years, I was suffering with that pain. Ki if I conceive, then it should survive. If I conceive, it should survive. And I did not take any treatment. And this was just a natural conception. But because I was in so much depression for 2 years, then later 2 years were also painful. So there was a lot of economical pressure also at my place, because my husband was a single earning member and we did not have a backup. So because this was a precious child, so I always wanted a private doctor to attend me. And therefore, my husband said ki we will go to a private hospital where we will do all the investigations and everything. But what happened is ki because I had so much of economical pressure, I was like ki we should conceive or not conceive. That was also there. So there is lot of anticipatory anxiety, that fear, should child survive or might not. The fearful prayers, out of fear, she said ki I would daily perform prayers, pray to God that every thing should be normal. Even I suffered hypothyroid during those early pregnancy periods, and there was so much of financial worries that I felt like yaar, what will happen in the future again if we lose this child? Then we are losing not only a child but also the finances. So the word she used was dehshat, and she said ki that word was continuously there throughout my pregnancy, even before. Ki what if I undergo the repeat examination? Again, the child should be normal. So that fear of survival of the child was so important. And again, I should not lose this child. And because in the past I have lost it, so this is what is devastating to me. I'm not yet come out of the past event, and still I'm living in that past, and still these people are, again, I have a challenge in my life. So I want, but I said, matlab, the question was asked was ki theek hai na, don't have a child. Why you want to have a child then? If you are in such a state and everything is settled, so why don't you want to have a child? So ask this question. So the child mother said, ki no, because I don't have my parents alive now. There is no one to take care in my family. Even I don't have siblings. I know what loneliness is. So I don't want my child also to have that lonely childhood. And I want that my daughter should have some company of a sibling. So therefore, I want a child. And since I see my daughter, every time I see my daughter, I feel that there should be a company to her. So you can see the whole insecurity, that psychosis creeping in. Okay, I want my child, I want my sibling. I have suffered loneliness, but I have that insecurity for the future. So I want my daughter also to have a company. So why that psychosis is creeping in and from where? But that fear, that fright, that I might again lose this child was something syphilitic and which was there. Even I asked her, I confirmed over here, ki, is this thought only now when you're pregnant? It was only when you were pregnant because she came 4 years later. Well, no, ma'am, it was there before also. Ki, if I conceive, I should not lose. If I conceive, I should not lose because I've already lost two children. So there was lot of lonely feeling in the child. And during pregnancy, she said is, ki, I don't know why, but I was like, ki, because we were spending so much of money, right? So there was a lot of pressure, and I was kept in a room where I was set to have bed rest, and I did not have a desire to talk to anyone. I was just lying in the room all alone, and that was really not good for me. I always desired that someone should come to me, pamper, talk to me, but I did not have anyone in the family to support me. So I took see the rubrics which will come up over here. I started thinking now. See, I will give you an analysis process. Now, how will you go ahead? So, is it a misfortunate feeling? Is she feeling ki I am very unfortunate that I lost my child. Now, second child will also come up. So, fear, misfortune, where will it come? No, this is not misfortunate. Then I ruled it out. This is not only misfortunate because here she is not blaming her fortune for that. Okay, not like previous case where she's blaming herself. She's more of anxious. She's more of worried. She's more of anticipating things ki what went in the past will not repeat in the future. So this is not always misfortune. Okay, there is no torture in the family. There is no bond breakage in the family. There is more of loneliness in her, and she desires. She's craving that someone should be around, and exactly same thing is found in the child. So, is it sadness? Then I started thinking about, is it sadness that something misfortunate will happen? Yes, this can be, because here, what thought process was there? Ki something unfortunate has happened in the past, and because again that fear is creeping inside my mind, now I'm feeling like I don't feel like talking to people. I feel lonely, and I have that fear ki again something wrong will happen. So we can take this part. Then there was a rubric which has to be interpreted. What exactly thought was going inside her ki I had a loss in the past. So now again, I should not suffer the same loss I suffered in the past, which should not be there in the future, which was always there. So she had that fear that she will be again passing through that pain of abortion, losing the child. So the rubric which I interpreted was delusion, injury, injured is being, because it was there since life. See, there are two rubrics: delusion, injured will be, and delusion, injury will receive. Delusion, fear, misfortune also. But all these rubrics go to more deeper level. They all are, see, you have like when you are taking an electron, proton, and a positron. So the electrons which are outside the shell, they are very close to it, but you have to go more deeper, which is the exactly mind process. Yes, this is fear, this is anticipation. Definitely, this fear will carry a meaning, a value to it. This will add on, but it's a very big rubric. So you have to taper it down and understand what is the deeper thought related to misfortune, related to her past experiences. What is more painful to her was that loss ka feeling, which was killing her inside. Ki now again, I should not lose something which is very precious for me. Then this rubric was there. Then what happened was throughout the pregnancy, before that state, she was in the phase of anxiety. Okay, this was more to the state what she was suffering. She was anxious of being alone. She was anxious that she will lose the child. She was anxious that she will again get into that whole process. She was anxious that जो past में हुआ वो फिर से future में ना हो जाए. तो that delusion, anxious, was more appropriate, which I felt. Then now coming to the another rubric, that is she a girl who is a female with lot of anger? No, there was more of care and worries which was constantly creeping her mind. Okay, so if you combine all this delusion, misfortunes, fear, misfortune, sadness, delusion, injury will receive, the remedy which was coming up were sulfur, rustox, and phosphorus. Before coming to this repertorization, I would like to say is that when you see this rubric, delusion, anxious, this was a marvelous rubric, because when I got this rubric came to my mind, I solved another case of my OPD where I would find that female was constantly in that state of anxiety that something will happen. You just examine me, something will happen. So those hysterical patients also, hypochondriac patients also, when they lose their phase of mind and they get stuck up, like hypochondriac is a very big rubric. But when they constantly, I have a lady, they constantly come to me, you examine me, I will get this, I have cancer, now I have got hair loss, so is it cancer? So they go into that extreme phase of anxiety where they lose the connection of reality. So you can take this rubric. So this lady was also more into that phase of anxiety, and that anxiety was continuously there. She was suffering that anxiety not only few months but from years together, and therefore it becomes very important rubric. And the remedies which were coming up were aconite, anacardium, calcarea. Yes, we can think of calcarea because the child was, but no, the calcarea will not learn gadgets so well. The child was into gadgets so well. She is not Ignatia. The child was not carbon element. The child was very affectionate, very good, very smiley. I'll share with you the child and go. You can see the video. See the child. See the child when he had come to us. This was where he had come affectionate, clapping, wonderful, smiley. And after our treatment, this is the change. The mother says he has really changed, improved. Important was that he had attained a balance, and that balance was like he had balanced, that balance was attained, and the mother was really very happy because whatever she was teaching him, he was very grasping, and his speech has come up, which was not there till 4.5 years of age, and which had come after our remedy. And even the thing was that he was not toilet trained completely. After a remedy, the restlessness has reduced, his grips and his motor activities had improved. Now he was able to hold the bottle properly, which was not there before. And you know what? When the things come up, है ना? And when the case comes up, sometimes during the case taking, the mother forgets to notice something. And when you give the remedy, and it's like a eureka moment for the mother. And then we ask and we observe the child. कि ये तो पहले ऐसा नहीं करता था. Now this is the change. So those change need to be observed. Even the change was like ki within few months you can see the look of the child. Now when we try to control him, he is able to control. Before he was very restless, very hyperactive, very excitable child. Now the mother is saying that even in the school he is very obedient now, which was before also, but his learning capabilities have increased. Even teachers have noticed that he has become very good child, and immunity has improved. The most important thing is the immunity has improved. I committed, yes, I committed a mistake in this case later on. Ki I was misguided ki there is no change. But then I observed that yes, the change are definitely there, even on the features, on the behavior. So this is case number 2. Now, case number 3, the remedy which we gave was phosphorus. Now the case number 3 of a child, she had come to us, great child, and she had come to us with Down syndrome and global developmental delay. The developmental delay was like कि mother said कि till कि इतना delayed था उसका dentition कि I don't even remember when the teeth had come up, almost around 3 years, and even the fontanelles closed after 3 years of age. So this was something very remarkable. Even Down's children, even if developmental delay, please notice what development has got arrested. It is speech, it is frontal, it is walking, it is sitting, it is standing independently, it is standing with support, which even if the delayed milestone, which has gone far back, that can also give you a leading remedy or some thought process, because this is global developmental delay and she had recurrent coryza. Speech is not yet developed. Mother said she has hardly babbling, few words, ma, pa, only that. And she's a very good child, but her motor skills are very poor. She cannot hold anything. She cannot even drink water by herself because she cannot hold. Her minute grips are very poor. And there is a constant thumb sucking which was there even in front of us. The child is constantly with that thumb, and that is the left hand. So thumb sucking is again a sign of gross insecurity. Even in normal children, if you see thumb sucking, you ask where the mother was insecure during the pregnancy, because thumb sucking is not something come at the conscious level. The person who do thumb sucking or any finger sucking or some behavior since early childhood, that is responsibility of the mother again. So they are very timid. Those people who are like into their own world, they get connect when the child really goes for thumb sucking. Na, they have certain behavior. Either they will play with their hair, they will play with their nose, and then they keep on sucking. And when they are sucking, they are into their own world, so they get really disconnected to the outer world. So thumb sucking also is a denotion of insecurity, of low of confidence, and even going into their own fantasy world because of thumb sucking. I have seen a male of 20 years almost who had the habit of thumb sucking during sleep. Without thumb sucking, they cannot go into sleep. So after digging that case, I found so much of insecurities into his life, which was not shown to the outer world. For outer world, things were very different, but only thumb sucking could lead me that there has to be something inside which is deep down the subconscious mind. So child behavior, this child is very bashful child, very soft, very sober. And when she comes to me and I'm like, kashi is, then she will just have one eye ऐसे थोड़ा सा ऊपर उठा के, then again she will come down. She will never have an eye contact with me. She is very like clinging to mother. She will not even make a single sound. I have not heard her talk anything in the clinic. No smile, nothing. So bashful, so timid, calm and quiet. कोई भी चीज में आवाज नहीं. Even if she will cough, she will have a low tone of cough. Not very obstinate child, but yes, mother says ki she is not obstinate, but I found that yes, somewhere she is very rigid also. She will do whatever she wants to do. So that is also a part of obstinacy, but not a cranky child, I should say. Mother's pregnancy history is like, again, this is a late conception. Mother already was very elderly, and it is again a case of trisomy, and where there was a history of abortion before the child conception, and the child was premature at 8.5 months. She was born, and mother said ki during the pregnancy, everything was good, everything was normal. Only thing is ki I was already 35 plus when I conceived, and my elder daughter was already there. So I was like, ki, why we are not having a conception? We should have a second baby. This was what our feeling was during the time period. But what happened, unfortunately, is ki with treatment, it was a naturally conceived. We tried a treatment of 2 to 3 years, but still we were not able to conceive. So we gave up. Ki, yes, now we won't have a child. So what happened is ki we stopped the treatment, and since my elder daughter was there, and we married in 2008. It was already a consanguineous marriage. It was an arranged marriage, but we were into relationship. There was buatya, some relationship. So it was already a consanguineous marriage. So I was like, we are already into this elderly age. Now I was not prepared for the second marriage, but mother, husband was insisting ki for the child, for the daughter, you should have a child. Before we were into Bangalore, and then we shifted to Nagpur. So when we came to Nagpur, we found that there was no one around us to take care. So I was like, now when we came to Nagpur, that time I conceived. And I felt like that fear, that insecurity came to my mind. Now what? We are already into a place where I don't know people. I am into a place where I'm not prepared to get pregnant. And we were into Bangalore, we were taking treatment over there. At that time, I was okay. But when we shifted to Nagpur, I was actually not prepared because we had just shifted and everything was hodgepodge. We were settling, things were not so good. My husband had to earn, and financially also, we were not going good. So I was not mentally prepared for it. And when we conceived, I was the first person to tell my husband ki matlab before I missed the age and UPT came positive, I told my husband if it comes positive, I'm not ready for the pregnancy and I want to abort. So husband convinced me ki yaar, we have already taken so much of treatment and now if it is a blessing coming to your place, don't worry. I was like, who will take care of my daughter because there is no one whom I know? Who will take care of me because there is no one around me which whom I know? So their intense desire was again that insecurity which was there. And again, she said ki I was like ki I was not I was very excited. Just I was like ki I was confused over there ki I must have been very excited for this pregnancy because we were planning it from such a long time. But somewhere I found that I was not happy inside, and that anxiety was so much making me restless ki I could not even share this to anyone because there was no one around to understand. I was not ready, but husband said ki yaar, why should we lose someone's life when it is a blessing? So we continued. And even my father-in-law died at that time. So there was a lot of hodgepodge in the family. I was not affected with that death because he was old and he was already suffering a lot. So that was okay. And everything went out, but even Corona was there at that time. So there was a lot of fear and anxiety about the diseases also. So but before the conception, already we were into so much of things. And again, now this is something which came up, though it was planned, but the situation was unplanned. So everything was not under my control. So I wanted to go for abortion. So the whole history is like this. Now, what you will understand, Kyuki, there was no support in the family, the COVID came up, everything. So what you find is a lot of things are going inside her mind and she's fighting with her own self, right? So the rubric which I understood her was over here was antagonism with herself. Because there is a thought, she already took a treatment, right? And now there is a fight against her own desire. And now she's not able to verbalize also. There is a lot of fear, there is a lot of anticipatory anxiety, definitely a loss of support in the family, there is a fear. But see, in first case, there was fear that I will lose the child. That was fear of loss. You know? That fear of injury was there. But here, it was like two thoughts which were going in her mind. That is what a duality situation she was fighting. I want also, for that I was craving, I took treatment, I did everything. Now the situation is such that I cannot even continue with this pregnancy. So there is something which is going contradictory into herself. That is what I interpreted as antagonism herself with. When your whole will is again contradicting. See, this is confusion also, this is contradiction of will also, but more deeper if you go, because we have to hunt something which can cause mutation. Was this because when I asked her she said this thought was constantly going because we had to leave the treatment, we came here, what if I get pregnant here, what will I do? So that duality thought was continuously there, and therefore I took this rubric, Econite, the remedies which were here, and this child, when I saw the need of the mother was a need of support. She was like, I am helpless over here. I'm feeling alone. I'm feeling that there is no support in the family. There is no one to take care of me. What will happen to my child? मेरी daughter को कौन संभालेगा? I already have so much of responsibilities. It is again a fear of responsibility also which was creeping inside, right? So the rubric which I took was there is anxiety anticipating, there is anxiety future about. All these are story rubric. I'm just explaining to you, therefore I took it. But the only rubric which I took was the antagonism herself with, and there is also one anticipatory anxiety of future because the situation today is not supportive. So when I understood the whole case, then retrospectively when you see the body, the constitution, the child is very mild, very bashful. So bashful may, which are the remedies we have to see? Exactly. So many children come to you. Don't take only bashful and prescribe. Go to a rubric and then match the disposition of the child which has. There is no anacardium like features, like she's not destructive, she's not angry, she's not quarrelsome. There is nothing like antimtad which is there, right? Antimonies are aversion to bath. They are hefty, nothing like that. She was intelligent, she was learning things, not like exactly like a Baraita, that hiding people and poor intellect. Whatever being taught to her, she mother said ki she's not able to speak out, but she will learn all the rhymes well and she can act out whatever rhymes are being taught to her. Then, if you think about cases, there is nothing like Ophidia's coming up. There is something indifference, we say, indifference to the child. No, she was not indifferent to the child. She was more worried. She was more anxious. She was more worried for her elder daughter who will take the responsibility. It was all revolving around responsibilities, about diligence. The child is also a very diligent child. She will never trouble. Even in the clinic, she has got such a bad cough, I'll tell you. Matlab, you hear the sound, you can hear that there is so much of complaint. And I asked her कि इतना chest में complain होता है. बोले ma'am, every 15 days she suffers, but not a single time this child will give any trouble to the mother. So the non-complaining child with now match the body where she said कि her fontanelles closed at 3 years of age. So delayed का भी delayed है वो. So this was extremely very much delayed. So diffusion, some bony constitution. She's very soft. You will see her. She's very soft. Like you call her, she will come to you, close to you. She will not talk to you, but if you touch her, she will allow to touch her. So the remedy which we gave was Cilicia, and yes, we got result. Now when I summarize all the cases, what I have seen from my cases, then I find that maximum cases I said ki have got 100% history of abortion. Therefore, their rubrics which I sought out during downs were delusion, lonely, giving insecurity. See, what we did in rheumatoid arthritis was taking the keywords of two keywords we had taken over there. Here we are taking the keyword of insecurity, that lonely feeling, that want and desire of company and everything. So we get a theme where there is delusion, lonely, delusion forsaken. This is very strongly there in one of my case where the mother said ki I could not tolerate that no one was paying attention to me. There was a family member which was not paying attention to me, and I felt very lonely. And that forsaken feeling was very deep grounded. And because I was so lonely in this world, I did not wanted to conceive also. But this child came into the world, and now I feel so sad and depressed. So the lonely feeling, lonely always. Then illusion head belong to other. When this rubric can be also taken in mental retarded cases, which is very strong rubric where you find that they cannot take decision because there is lot of domination in the family and they cannot take their own self into the value system, and their value is also where they are very timid people and they say ki there is an incident, I'll tell you. When we were dealing with the case, we asked her ki what did you do? Well, nothing, whatever my sasuma said I used to do. Why you used to do whatever your sasuma said? Because I did not wanted a conflict. So she used to say ki this is day, I used to say okay, this is a day. This is a night, I used to say this is a night. Why? Because I was too fearful she will bang me up, or I was like कि क्या घर में कलह करना. So I did not wanted conflicts. I wanted harmony and peace in the family, and therefore I did not put my head into it. So this is where delusion, head belong to others, can come up. Delusion, injury will receive. I have already shared a case. Fear of misfortune. Yes, something wrong will happen, and if I commit anything, my daughter, my children will definitely suffer. Doctor, मेरी तो जिंदगी में I don't have a right destiny supporting me, and whatever I do, I get failure into my life, and this is where my destiny never supports me. Anxiety, abortion threatening, because I had so many anxiety abortions in the past. This is like I'm very sure, I'm very fearful that this child will also get aborted. So that fear which is there deep down into her thought process. Then fear of injury, again, that will be taken up as delusion, injury will receive. Delusion, sadness, I have become gloomy, I have sad because I feel my life has changed totally. I had this case of delusion sadness where the mother said ki because of pregnancy my whole life has doomed. So delusion doomed will also come up. Head belongs to other. Confusion, identity of, when it is a conflict related to identity, when they are being forced कि मतलब it can be sexual identity also, or it can be even the existential identity. This can come when you take confusion identity, when it comes in generational rubric also. Antagonism with self is more for autoimmune diseases because confusion can go at least psychotic, but antagonism is when the will is being opposed. So this is more syphilitic rubric for will contradiction, and antagonism with self is more deeper. Fear of death, anticipatory anxiety, delusion forsaken, delusion neglected, all these things will give you fear and insecurity. So developmental arrested, if you don't find anything, take mother's rubric, and if you don't find anything PQRS in the disposition, you can just combine it with development arrested. So I've already shared with you the cases. So any doubts? These are the characteristics of Downs. Whenever you're treating a child with these spatial capabilities, please try to find something which is very unique in them, something which is not common in them. And when you take these children near to you, will find they're really very affectionate, they're very intelligent also. They can even sense the pain. I had a child who can feel the pain of mother. If mother cries, I'll tell you, this child whom I have narrated the case, she said ki this girl is so much affectionate and so much loving that if I cry, if I feel sad, she starts crying. She can feel my pain. They are so empathetic and they are understanding the emotions. So they are not the people who don't understand the emotions, right? So they have lot of feelings. They have lot of love in them. So once you start loving them, they will give love back to you. I have a child who comes, who will touch the feet of everyone over here, and they like hugging to me, they like loving to me. I'll tell you ki when I was taking a camp and it's a different place, there was huge mob. But these down children could recognize even we were passing out, and they would just pop up with a smile. They will come running behind. ऐसे जोर से पकड़ लेंगे, and they like hugging people. So please understand the whole constitution. If they are bashful, take it. If they are loving, they are caring, they are affectionate, take it. So they have got a good life, they have good relationship understanding, because there is psychosis also, they want something extra. So Down's children want extra love, they want extra support, that is what they are craving for. And they have got a good life ahead, they have got a good life, even 50-60 years is what the lifespan they have. So this is what the miracle of Down syndrome is, ki though it is a mutational disorder, but because it is not syphilitic, it is not that destructive. It is just a chromosomally enhanced Down syndrome. So the t-shirt itself said ki we are not something which are lacking, we are something which have got an enhanced capacity. So we want that love, that friendship, that care and acceptance from the society, and there we can grow. So thank you. This is end of the lecture. We can go ahead. Any doubts? We can take the lecture. There is a question that can Down syndrome come even after years of life, even when triplet marker is negative? No, I don't think so. See, again, you have to understand what disease we are suffering. If it is a mosaic pattern, as I said, ki it might go unnoticed, but mosaic pattern or Down's mutation cannot happen in later part of the life. It is not even observed right now. I've never seen such a case where it has taken a mutation in the later half. The mutation is always at the part of conception or before conception. Potency, what I have used, because I could not get cyclamen in higher potency, I have taken 200 only. But yes, with 200 also I've got results. But if you feel stuck up, I think we should start with high potency. We can start that also. Delusion doomed and delusion unfortunate. Doomed and unfortunate are two things. Doomed is something related to fortune only, but a very deep down feeling of doomed is different. एक second ना. See, when you feel doomed is like कि मेरी लाइफ में कुछ भी अच्छा नहीं होने वाला है. Unfortunate is when you feel कि doomed is what, सब कुछ बुझ गया लाइफ में, सब कुछ खत्म हो गया, सब कुछ तबाह हो गया. I find no ray of hope. That is doomed. And unfortunate is I am not lucky enough, and whatever I will do, I will not get success in my life, and my destiny will never support me. Yeah. So there is, in doomed feeling, there is no hope that something will happen. In unfortunate feeling, they feel that my destiny, my karmas are not good enough, that something will happen good in the future. ADHD cases, again, if you go and see my, I'll share a whole video, because it's ADHD is again a spectrum. It's a huge cases to be understood. ADHD is again a case to be understood where there is hyperactivity involved, either with autism or without autism also. So there is lot of restlessness, lot of anxiety. So you will see restlessness and anxiety in the ADHD is not because of some mutation in the first trimester, but ADHD is coming in the second trimester and the third trimester. So take the conflicts from there. It is more of fear, fright, which will come up in ADHD. Lonely, rubric, and delusion persecuted. Lonely is different and persecuted is different. See, lonely is when you feel that there is no one in your life, and persecuted is like कि you feel have the feeling कि सब मेरे पीछे ही पड़े हुए हैं. लाइफ में ना मेरी सास, मेरे ससुर, मेरा whatever the people around me are just running behind to harm me, or they just want something wrong should happen to me. So that is what persecuted is. So yeah, thank you for appreciating that it was elaborative and informative. But yes, I want that you should apply this knowledge, these rubrics. And what sir would always say is कि once the case is delivered, once the knowledge is delivered, please imply it. Once you attract the cases, take it that more Down's children should be treated by predictive homeopath, and such camps should be conducted all over so that a lot of people are benefited. Since the syphilis is growing, the world is moving ahead, lot of mutational cases and congenital anomalies are coming to our doorstep. So such cases, such results will give wonderful understanding to you. So thank you. I think there is a query. Lonely forsaken से कैसे different है? See, loneliness is a feeling, right? Forsaken is more deeper than loneliness. In loneliness, there might be people who are there, but in forsaken, you feel that person is ignoring you, that person is not giving love to you. In loneliness, it is a feeling of individual कि in spite of having everything, still I feel lonely, right? In forsaken, it is involving the other individual along with you, where you feel that person is not giving you that much love which you expect, that attention which you expect from that person, and therefore you feel that detachment, that awareness, or that feeling that you are left back behind. In lonely, it is like there can be so many things, still it is your personal perception ki you are alone. Both are perception. Definitely forsaken is also a perception, but in forsaken it is a feeling, expectation from other. Miasmatic medicine for Turner's. Turner's disease, please go and check the rubrics from identity, because this is sexual identity. So you will get rubrics at the level of errors identity of is the rubric for Turner syndrome. And one more thing to take into consideration is don't give assurance ki after giving the medicine, the whole process will get reversed and you can, no, you can, it is not possible to revert this clock to from mutation and go to unmutational cases like RA positive going to RA negative. Like a Downs, once a Downs is a Downs for the whole life. Once a Turner is a Turner for the whole life. Turner syndrome is sexual identity conflict. So it is go and search rubrics for identity.